Hello everyone, I'm Dr. Tefe Debi. I'm a consultant psychiatrist and a psychologist. I make videos on mental health education and self-improvement tips. The goal is to help demystify mental illness and provide you with tools that will help you be your best and live your best. On today's video, I'll be talking about self-help coping strategies to manage bipolar affective disorder. Bipolar affective disorder is a condition, a mental health condition with extreme dysregulation of the mood. It is also called manic depressive disorder. Those who suffer from this condition, the treatment is really medication and therapy. But in addition to medication and therapy, there are things that an individual can do to help better manage the conditions. Now, it will require some lifestyle adjustments. Just the same way someone who has diabetes will be required to make some lifestyle adjustments to live a better life when diagnosed with that kind of condition. So also someone with bipolar would require that they make some kind of lifestyle changes to help better manage the outcome. Now, these strategies are not in themselves guarantees that there will not be a repeated episode, but they help reduce the chances of a repeated episode. They also help address the intensity and the severity of the complications that could arise as a result of an episode. I will be talking about 7 coping strategies to manage bipolar affective disorder. The first strategy is educate yourself about the nature of bipolar. Information, they say, is power. Being informed about the nature of bipolar literally is a game changer. It helps you to take some level of control over the condition. So just in case you have this condition, don't just bury your head in the sand and ignore, but rather I will encourage you to go on the internet or ask your therapist or ask your psychiatrist as much as you would like to know about the condition. The second thing is create a routine. Now, it's very important for those with bipolar disorder to actually have a routine. Having a routine is important to everyone, but particularly for those with bipolar disorder, it's important you have a routine. Have a routine for the time you take your medication, have a routine for the time you walk, have a routine for the time you study, have a routine for your meals. Create a routine. This helps you to reduce your amount of stress, because particularly for those with bipolar, a change in routine and a change in events can really trigger and stimulate them more than every other person. The third thing is pay attention to your sleep. Now, sleep is a known fact. In terms of sleep deprivation is a known fact or a known reason, a research-proven reason that can trigger a manic episode. So paying attention to your sleep is something that you need to do with all intentionality. In other words, you need to pay attention to sleep hygiene, have a sleep routine, your wake up time, your go to bed time, and also track your sleep, because your sleep is one thing that will normally be easily influenced when you are having a relapse. The fourth thing is to record your mood. Pay attention to your mood. It's not something really complicated. It's something very simple. All you need to do is basically, you could just take a record and have somewhere on a scale of 0 to 10, recording your mood. This helps you to track a fluctuation or help you to track any form of fluctuation that may go on with your mood. It's very important you do that. Number 5 is exercise. Exercise is very key and very important in management of bipolar. Now, particularly if you are experiencing the depressive pole of bipolar, it is a mood stimulant. It helps improve your mood. So exercise is very important in managing bipolar. Number 6 will be avoid alcohol or any other mood altering drugs. cigarettes, cannabis, that's weed, any other mood-altering drug can impact on your judgment and can just stimulate your mood in such a way that could trigger a full-blown relapse. So you really want to avoid that. You want to reduce it to the barest minimum and possibly just completely avoid. Remember, I did mention, just like in diabetes where you have to make adjustments, when you are also diagnosed with bipolar, it does require that you make certain adjustments. So you may say that I've been using drugs prior to my diagnosis, they calm me, they help me and all of that. But once you are diagnosed with this condition, it's important, just like the person is advised with diabetes to avoid certain kind of meals, you are advised to avoid alcohol and other mood-altering drugs. And then the seventh, and definitely not the least, is find a support system. Your support system could be your family, could be a wider community of those who have a similar condition with you, who also have bipolar. Find a community where you can find that kind of support, people to talk with, people to connect with. Even your therapist, and in terms of your doctors, your psychiatrists, can be your support system. You want to create that support system, because with bipolar and with having episodes of bipolar, one of the challenges people will face will be that they will experience some form of effect on their relationship, existing relationship. They may say things or do things during an episode that may have profound effect on others. So you want to find the support so that you don't feel overwhelmed, particularly when you come out of an episode. So having a support system is very, very important. Don't shut people off, don't shut people out, rather include them and find that connecting group that you can connect with. I hope this video has been helpful. I hope you picked one or two things. I really dedicate this video particularly because this topic is something that I consider dear to my heart, and I do dedicate this video to everyone that's struggling with this condition, and those who are also their loved ones and their support system. Just in case you have not already subscribed for this video or subscribe on our YouTube channels, kindly do that. That way you don't get to miss out on any of our subsequent video on mental health and self-improvement tips.